Welcome to the Maternal Health Symposium. I'm going to start off by introducing Dr. Jean Sumner. Jean Sumner has always cared deeply about the health of rural communities. A third-generation Georgia physician, Dr. Sumner has served in rural Georgia most of her career, practicing medicine in Washington and Johnson counties before becoming dean in 2016. Dr. Sumner came to MUSM as a community faculty preceptor in 1989, became associate dean for rural health in 2014, and has held a succession of leadership positions over the years. She has served as hospital chief of staff and nursing home medical director, as well as a board member chair and president of numerous community and statewide professional organizations. At the state level, she served as a governor-appointed member, then president and medical director of the Georgia Composite Medical Board. In 2020, Dr. Sumner received the Ralph O. Claypool Sr. Memorial Award from the American College of Physicians, the first Georgian to receive the prestigious award. She is also a fellow of the American College of Physicians. Dr. Sumner received a Bachelor of Science in Nursing and Master of Science in Nursing from the Medical College of Georgia and completed her medical degree at Mercer University School of Medicine. She completed her internal medicine residency at the Medical Center of Central Georgia. Welcome, Dr. Sumner.
Thank you, Alex, and welcome to all of you. So, how many of you have been to this symposium before? If you raise your hand. That's great. So we're glad to have you back. How many of you have never been to Mercer before? Okay, I'm going to tell you a little about Mercer because it is a great place. The School of Medicine was created in '82, and we're funded by the state. We get partial funding by the state for our mission, which is to improve the health of rural Georgia. We take our mission very, very seriously, and everything we do focuses on that mission. We have 3 four-year campuses. Macon is our home campus. Mercer's been in Georgia since 1833. The second campus is in Savannah. We've been there for over 30 years. And we went to Columbus about 15 years ago. In the last few years, we've established a clinical campus in Valdosta, and we're going to open a clinical campus in Tanner Health Systems in the next year. We send students there now. We don't try to spread out like that. We go where we're invited, and we go where they need to address health status. So everything we do is about educating young doctors to go out and serve our state and helping improve the health status of our state. And if you learn more, you'll see we don't waver from that mission. We preferentially accept young people outside of metropolitan Atlanta. Now, we have lots of great students from the metropolitan Atlanta area, but across the country, less than 5% of students in medical school programs, MD programs, less than 5% grew up in a rural area. So, if you grew up in a rural area, and I did, I'm from Sandersville. I loved being in a small town. I'm used to a small town. My grandchildren live in Atlanta. It still makes me nervous when I go up there. I like Atlanta, but I like it for about 3 days and the grandchildren need to be there. I prefer they come home. I love small towns. If you grow up in that environment, you're used to that environment, and you love that environment, and you're more likely to go to an urban area. We believe that our students are our mission, and that we give them the skills they need to be successful in rural communities. And one of those skills is the ability to really have a broad range of skills. And that's what rural Georgia needs. But you're the heroes today because you're out there doing the work that changes our state. And this state is a great state, and we spent a lot of money on health care. But we hadn't changed the outcome in maternal mortality and infant mortality, and we've got to do that, and you're the secret to that. And so every conference we have here doesn't cost you anything. We do that because we want everybody to come, and we try to bring in good speakers and people that you will learn from, but we also want to hear your voice. You're on the ground, you know what the problems are. together we can figure out those solutions. So I welcome you to Mercer. We're honored to have you. We did have a leak in this building last night, I'm told, and that's why that machine's out there. So my maintenance guys at the School of Medicine are helping the university patch the leak, so they'll get it fixed. But so if you get a little drip, don't get scared. We had a pretty bad storm last night. But anyway, we're very honored to host you, and we applaud the work you do. And if there's any way at all that Mercer can help you or help your community, we show up, and we believe that you have the capacity to solve those problems. We're there to help you. We're there to bring resources. We're there to bring whatever you need to address the issues in your community. So thank you for being here, and come back next year. So good to see you.